Okay, let's talk about juvenile diabetes mellitus. So, what is juvenile diabetes mellitus? So, juvenile refers to children. So, the diabetes which is occurring in children is known as juvenile diabetes mellitus. So, if we see the definition, it is a chronic metabolic disorder characterized by hyperglycemia as a cardinal biochemical feature caused by deficiency of insulin or its action, manifested by abnormal metabolism of carbohydrates, proteins and fats. So क्या है? Chronic metabolic disorder है diabetes. So कैसे पता चलता है? So we will find hyperglycemia. So it is characterized by hyperglycemia. Hyperglycemia is increase of sugar in the blood. So यहाँ जो cardinal biochemical feature we are going to see, क्या मतलब क्या है? So important feature or a change in the blood we can see is क्या होता है, क्यों कॉज हो रहा है, इंसुलिन के वजह से हो रहा है. ये हाइपरग्लाइसीमिया जो चेंज हो रहा है ब्लड में वो क्या है, हाइपरग्लाइसीमिया हो रहा है. क्यों हो रहा है? डेफिशिएंसी ऑफ इंसुलिन और इट्स फंक्शन. सो कैसे मैनिफेस्ट हो रहा है? सो अबनॉर्मल मेटाबॉलिज्म ऑफ carbohydrates, proteins and fats we are seeing here. So the definition is chronic metabolic disorder characterized by hyperglycemia as a cardinal biochemical feature caused by deficiency of insulin or its action, manifested by abnormal metabolism of carbohydrate, protein and fats. इफ़ वी सी डायग्नोसिस, कैसे हमको पता चल जाता है? तो सिम्टम्स को देख के हमको समझ पे आता है क्या क्या हो सकता है सिम्टम्स. यूजुअली यूरिनरी फ्रीक्वेंसी वी कैन सी. सो इन बच्चे इन चिल्ड्रन कैसे पता चलता है? नॉक्टूरिया वी कैन सी, नथिंग बट बेड वेटिंग. रातों में जो यूरिन पास करता है बच्चे, सो उससे पता चल जा सकते हैं. एंड ऑल्सो इन डे टाइम क्या होता है, इनकॉन्टिनेंस होने का चांसेस है. डे टाइम इनकॉन्टिनेंस बोलते हैं. दे कांट कंट्रोल द passage of urine. Okay, this is one sign we can see. And weight loss we can see. And polydipsia is they feel more thirsty, they drink more water. Next, fatigue वो थकावट लगता है उनको. ठीक है. तो यूजुअली अगर हम ब्लड टेस्ट करवाएंगे, अगर रैंडम ब्लड शुगर लेवल मोर देन 200 mg/dl रहेगा, mg/dl रहेगा, तो वी कैन गो फॉर इट इज़ diabetes mellitus. Next is fasting blood sugars. If it is more than 126, usually it should be less than 100. बट अगर वो इंक्रीज़ होगा 120 के ऊपर होगा, 126 mg/dl रहेगा, देन वी कैन डायग्नोस इट एज diabetes mellitus. Okay. Next, if we see the physiology, the main function of insulin. So क्या है main function of insulin? First thing is it will reduce glucose. It will reduce glucose. So कैसे कैसे ये glucose reduce करता है body में? So main thing is hyperglycemia in the blood, isn't it? So उसको control करना है तो ग्लूकोज को कम करना है. तो यहाँ थ्री प्रोसेस के थ्रू वो करने का चांसेस है. फर्स्ट वन इज़ इट विल डिक्रीज glyconeogenesis. So this is the pathway used by the body to create glucose from the other molecules and allows the body to store needed energy for brain in the form of glucose. So this is nothing but converting glucose into energy. So it is going to decrease the gluconeogenesis. If this is continuously happening, so the glucose will be increasing in the blood and it will be damaging brain cells. So to control this, the process of gluconeogenesis is decreased by the help of insulin. Okay, the second process is it will decrease glycogenolysis. So यहाँ क्या होता है, glycogen is converted into glucose. Okay, this is glucose is the simple sugar or glycogen is the complex sugar, we can say. So the glucose, the simple sugars are used by the body for producing energy. So this is needed only when there is deficiency of glucose to body, so it is regulated by the insulin. So next one is increases uptake of glucose by cells. Okay, so अगर जो ब्लड में ग्लूकोज है वो अगर सेल्स यूज़ कर लेंगे तो ऑटोमेटिकली द ब्लड ग्लूकोज विल बी reducing, isn't it? So it will help in increase the uptake of glucose by the cells. This is the other process through which the insulin is reducing the glucose in the blood. Next one is it will inhibit fat breakdown by lipolysis. So fat is stored in adipose tissue, so insulin prevents entry of glucose into adipocytes when in excess amounts. So it will try to utilize by the body by lipolysis. So through this process also insulin is going to reduce the fat breakdown. Next is third one is it inhibits protein breakdown. So it is also called as proteolysis. By inhibiting lipolysis, insulin has a great effect of reducing the availability of precursors of synthesis of new proteins. यहाँ क्या हो रहा है, जो न्यू प्रोटीन्स फॉर्मेशन होने का जो चांसेस है उसको reduce कर देता है. So which is in turn this will responsible for glycogen synthesis. सो ऐसे क्या होता है, प्रोटीन्स का जो बढ़ने का चांसेस है उसको रिड्यूस करने में ये हमको मदद करता है. दीज आर द मेन फंक्शंस ऑफ इंसुलिन थ्रू विच द ब्लड ग्लूकोज इज गोइंग टू बी reduced. नेक्स्ट इज प्रेजेंटेशन. कैसे हमको क्लिनिकल manifestations we can see. Presentation is nothing but the clinical manifestations. कैसे पता चलते, although most symptoms are non-specific, हमको स्पेसिफिकली ये पहचानने में थोड़ा सा मुश्किल होता है. So first one is as we have seen polyuria. So they feel like frequently urinate. Next is polydipsia. So frequency of thirstiness. Polyphagia. So they feel like eating many times, okay, feel like hungry, and weight loss is seen. These are the obvious things we can observe. Recurrent infections are also seen related to skin and UTI, urinary tract infections. Next one is diabetic ketoacidosis. These are the presentations. Investigations, if we see, what are the investigations we can do in this? Blood glucose. So fasting blood glucose should not increase 126 mg per dl and random should not increase 200 mg per dl. So यहाँ HbA1c is a test we can do. So इसमें क्या पता चलता है, 2 to 3 months of ग्लूकोज का जो हिस्ट्री रहता है वो ब्लड में हमको मिल जाता है. ठीक है, द एवरेज ओवर last 2 to 3 months measure amount of glucose that attaches to hemoglobin. The target HbA1c is less than 7.5%. So the normal level should be less than 7.5%. ओके सो इसमें क्या पता चलता है 2 to 3 मंथ्स का जो शुगर लेवल्स जो है वो हीमोग्लोबिन को कैसे अटैच हुआ है वो हमको इसमें पता चलता है. ठीक है. नेक्स्ट कीटोन टेस्टिंग इधर यूरिन स्ट्रिप्स और ब्लड. सो यहाँ का कीटोन बॉडीज़ का जो प्रेजेंटेशन है वो हमको इससे पता चल जाता है. नेक्स्ट इज यूरिन ग्लाइकोसूरिया. सो यूरिन में शुगर्स है कि नहीं वो हमको पता चलता है. नेक्स्ट इज कीटोनूरिया. सो कीटोन बॉडीज़ का प्रेजेंटेशन वी कैन सी इन स्पेशली DKA सस्पेक्टेड पेशेंट्स. Next is management. How can we manage? Especially in children, type 1 is seen and type 2 is mainly seen in adults than children. So especially we have to treat the juvenile diabetic mellitus is type 1 we can observe. So how we can, mainly this is genetic reasons. Mainly this is having genetic reasons for acquiring. So how can we manage? So need team and special diabetic clinic. So we have to next is through treatment, insulin and nutrition. So blood glucose monitoring. Blood glucose monitoring should ideally be carried out 4 to 6 times a day. However, this is dependent on the availability of testing strips. So usually 3 to 6 times blood glucose monitoring should be done. These should be the recommended target blood glucose levels should be during the day. It should be 4.57 to 7.7 millimoles per liter.